Once you've done your consultation, now we're going to talk about a few particular stations in which IPS is a major part of your consultation, right? One such station is breaking bad news. How you're going to tackle breaking bad news scenario? The way you're going to do this is that you make sure that you ask about the red flags and while taking the history taking, but don't take full history. Don't waste your time asking about the full history of the patient. Try to disclose the diagnosis to the patient at the mark of 3 minutes or maximum 4 minutes, because afterwards you have to console the patient and there are going to be lots of things which you have to do for the patient, right? So try to break the try to break the diagnosis to the patient at 3 or 4 minutes, and do not take full history. Do not ask about past medical or social or personal history. You have to ask social history, but do not ask about these things in depth, because those things have already been done on the previous appointment of the patient, right? A major thing to ask about is ask about their concerns. Ask about their concerns during history taking. The patient would obviously tell you their concerns and you deal with them immediately right there and then, because once you've disclosed the diagnosis, the patient would be upset or depressed and you won't have time to deal with their concerns at that point. So you deal with the concerns right there and then in breaking bad news scenario. And Yeah, so another thing is, major thing is, you have to ask them about their social history. You must ask them about their support system. You have to ask them during history taking that who is there at home with you, or is there anyone you live with, or did you come in with anybody else? And the patient is obviously going to tell you that, yeah, doctor, my wife is here, or my I live with my husband, or and you ask them that are they around at the moment, right? And I'm going to tell you in a minute how you're going to use this social history afterwards in a breaking bad news scenario. So a major thing to do in breaking bad news scenario is to do layering. Always do layering in breaking bad news scenario. How you're going to do it, I'll just explain it to you guys now. Okay, so you are going to do 3 layers in breaking bad news scenario. You are going to break the news to the patient in layers. You are going to give them little information. You are going to let them feed on that information. You are going to let them digest it, and then you are going to move on. That is how you're going to disclose the news for a breaking bad news scenario in layers. First layer is, once you've done asking the history taking, this is how you're going to break the diagnosis to them. First layer is going to be that do you have any idea as to what is going on, right? Ask this to the patient, or you can say, then you can say that, John, unfortunately, I do not have a very good news for you. Alternatively, you can say that, John, I know that we sent your reports a few weeks ago or a few days ago, and I'm really very sorry to say that the reports are not as good as we expected them to be, right? These are some of the sentences that you can say to make the patient alert so that they know that something bad is coming, right? So this is going to be your first layer. Second layer, again, you are going to just deflect away from all of those investigations and everything. You are going to use your social history here, that you told me that your wife is at home. Do you want me to call her for you, or would you like her to be with you at this point? Or you told me that your husband is waiting outside. Do you want me to bring him in? Right? Before we disclose the diagnosis to you, you are going to tell them this, or before we tell you what is going on. Obviously, that is an exam and nobody else is waiting for them. The patient would obviously say that, no, doctor, just go on. Right? So this is going to be your layer 2 to make the patient even more attentive for what is coming ahead. Right? So in layer 3, what you're going to do is you're going to tell the patient. So you've already done 2 warning shots. First one was that the reports are not good. Second one was that do you want somebody to be with you, right? And make sure in a breaking bad news scenario you are sitting with the patient in front of you and you have an eye contact with the patient, right? If the patient is standing or patient is worried, you make them sit down before disclosing them the diagnosis, right? So in layer 3, what you're going to do is you're going to tell the patient that, John, whenever we do such tests, there can be lots of things going on. You can, this approach is called the bad approach and the good approach. So you're going to tell them that there can be lots of things that can be going on, from less serious things such as simple infections, which you don't bother about much, to something serious such as a cancer, and then give a pause of 2-3 seconds, right? And then say that, um, I'm afraid that is what is happening in your case, right? Or alternatively, you can say that, you can just explain the findings of the report. For example, if you found mesothelioma on the report, so you're going to tell them that, John, we found that you're having mesothelioma on your reports. And by that, I mean that, and then give a pause of 2-3 seconds, and then mention that by mesothelioma, I mean that you're having cancer of the lungs, right? When you disclose the diagnosis, right, at 3 or 4 minutes, give a pause of 10 to 20 seconds. Keep quiet for those 10-20 seconds. Let the patient take in that information. This will count in your IPS, right? And obviously the patient is going to get upset or depressed, and then you're going to tell them that, John, I can see that you are upset, or I can see you're worried, you're really very worried. Please take your time, there is no rush. I can see this is a lot to take in. Please take your time, John, there is no rush, right? You're going to say these things to them. Or you can say that, please take your time, John, this is, I can understand this is a lot to take in, right? You can say such sentences to them at this point. And obviously once the patient has done, like the information has gone into the patient, and then they'll start asking you questions. Doctor, am I going to die? Doctor, is this going to happen? Doctor, is that going to happen? And obviously there are going to be lots of tough questions, and not just in breaking bad news scenario. In a lot of other consultations, the patient is going to ask you really tough questions. So the way you're going to tackle them is just tell them that, honestly telling, I do not have answers to your questions right now, right? But let me tell you what we can do for you, so that we can get more closer to your answers, more closer to the answers for these questions. Alternatively, you can tell them that, John, honestly, I don't have answers to your questions at this point. But to keep the ball rolling, you can say that, but let me tell you what we are going to do for you, or let me tell you what we can do for you to keep the ball rolling and to move towards the management part, right? So that is how you're going to tackle those difficult questions. Alternatively, obviously the patient is going to be really depressed and really upset, and the patient would be talking a lot of things like, I should call my daughter to say a final goodbye to me, or I'm going to die, I don't have a lot of time left. The patient is going to say such things. So you can empathize with the patient by saying that, John, I definitely understand that it is a tough news for you, and it has been a terrible day for you, right? You can use these sentences and then tell them that the way I see it is that we have identified your disease, and now we can start the treatment procedure, right? We can move forward and start the treatment procedure, right? So these can be some of the phrases that you can say to the patient to keep the ball rolling and move towards the management part. Okay, so next one, we have a patient who is really frustrated, who is just refusing medical treatment, or who does not wants to stay in the hospital. The patient is really frustrated, or we have an angry patient, right? So I'm going to tell you guys how you're going to tackle them and how you are going to use your IPS to tackle them, right? So you're going to tell them that if the patient is refusing medical treatment, or they just don't want to discuss their condition, you tell them that, I can see that you don't want to discuss your condition, or I can see that you don't want to take this medicine, or you don't want to stay in the hospital. If this was me at your place, I would feel stuck in a hospital and I would feel the same, right? Tell them this thing and the patient would immediately simmer down, right? So if the patient is refusing medical treatment, you are going to scare them. You are going to scare them by using difficult words such as life-threatening. That John, if you're not going to take these medications, your condition can become life-threatening. And if this condition gets serious, it can cost you your life if not treated properly, right? You are going to use such words to scare the patient. um, if, if the patient is still refusing medical treatment, you are going to explore the reasons of refusal. Then why are you refusing it? Why don't you want to take it? Try to negotiate with them by providing them some alternative solutions, right? And try to negotiate with them with something which they might be happy about. For example, if they're refusing one particular medication, you try to negotiate them with providing them an alternative medicine, right? So if they still refuse, you've done everything, the patient is still refusing that, no, doctor, I just don't want to take these medicines no matter what, then obviously it is their right. They can refuse the medicine. You can mention them that, John, we can't force you to take this medicine. It is totally your decision and your right to make this decision. But and we can change that, and I would go talk to my seniors regarding this, right? So you're going to mention this to them, but still try to ask them the reason that why don't they want to take the medicine. Investigate their reason and try to negotiate with them, right? So yeah, angry patient. How are you going to tackle the angry patient? Uh, Angry patient is obviously going to speak a lot. Angry patient is going to vent out as soon as you enter the room. The angry patient is going to eat up your 1 or 2, maximum 3 minutes, and you have to let them vent out. You just have to sit there, nod your head, and don't just nod your head. Compliment it. Compliment that nodding uh, along with some words as well, such as uh-huh. Nod your head and say these things, right? Let them vent out for 2-3 minutes, because once they've let out their steam, they won't give you a tough time afterwards, right? So, angry patient, you are going to let them vent out, and as I mentioned before, that the patients, they're like little kids. You are going to give this patient a lollipop, you are going to make them shut up, and then you are going to talk about what you want to ask them, right? If the patient is just venting out that this medical error happened, or I don't want to stay in this hospital, or I am not satisfied with the staff's behavior, or I'm worried about this, or I'm concerned about this, you immediately give them a lollipop. Um, to make them simmer down, you're going to tell them that, John, I promise I'll discuss each and everything with you. Or, John, I'm here to talk to you regarding all of these things. But before that, let me ask you a few questions to make sure what is going on, or to get a better understanding of the situation, or to get a better grasp of the situation, right? You are going to say these things. And But before that, tell them that I promise I'll talk about each and everything. The patient is, you would give the patient a lollipop by saying this, and they would immediately simmer down. They won't give you a tough time afterwards, and they would let you ask the questions which you want to ask, right? So similarly, if it is an embarrassed patient, how you're going to tackle an embarrassed patient? um, Obviously the patient won't be making eye contact with you, or the patient would be looking here and there. You are going to recognize it and tell them that, yeah, is there anything you're worried about? I can see that you're not looking towards me, right? Or the way you can empathize with them is you can tell them that, I can see it has been really difficult for you to come in today and talk about this. Or just say that, I want to thank you for gathering all the courage and taking a step for yourself. And I want to thank you for coming in today and for opening up to me and telling me all of this, right? You can use these sentences to encourage them and to empathize with them, right? And furthermore, what you can say is, tell them that it is a safe place and we are not here to judge you, but we are here to help you, right? You can use these phrases. Or alternatively, you can say that, I'm really, really glad, John, that you came in today, and I know it wasn't easy for you. to take this step for yourself. And ask them if there's an embarrassed patient, and you can ask them that if they want anybody else to be here so that they feel more comfortable talking to you, right? And you can also tell them that I genuinely care for you, John, and I'm here to help you. I can see this is really, really difficult for you to talk about, right? So use these phrases in your consultation for an embarrassed patient to make them feel relaxed, to make them like feel valued, basically, that you are there to help them, right? Make eye contact with them, nod your head when listening to them, and most likely when you say these things, they will start speaking. If they still don't, then encourage them to talk, that I'm here to help you. If you're not going to tell me what the problem is, nobody else can, or I can't help you. If you're not going to tell me what the problem is, I can't help you, and nobody else can, and I'm here to help you, right? I'm here to listen to you, I'm here to help you. Tell them these things, and obviously they would open up and tell you everything, right? Similarly, as mentioned before, if the patient asks you a difficult question, you can say that I can see a lot is going on through your mind, and honestly telling, I don't have an answer to your question right now, but there are a few things which we can do to get closer to the answers, right? Or and then give them the solutions or the management which you are going to do for them. Similarly, if there is a telephonic conversation, there are some prerequisites for a telephonic conversation which count in your interpersonal skills. As soon as you call them, confirm their name first. Am I talking to John? Yeah, doctor. Okay, John, is this a good time to talk right now? Yeah, doctor, I was just waiting for your call. Okay, so John, can I check whether you're at home or at work? Doctor, I'm at home. Okay, so John, is it the same number that you want me to call if our call gets dropped? Yeah, doctor, you can call me on this number. Okay, so John, before we begin, can you please tell me how old are you? Yeah, doctor, I'm 34 or 35 or whatever. Okay, and can you confirm your address for me, please? Yeah, doctor, this is my address. Okay, and then introduce yourself to them, or you can introduce yourself to in the beginning as well. As soon as they tell you that, when you ask them, is it a good time to talk? Yeah, doctor. Then tell them that, okay, I'm Dr. XYZ calling from the hospital. Yeah, doctor, I was expecting your call. And then do these four prerequisites. Always do these four prerequisites in a telephonic conversation or in a video call as well, right? Okay, so now we'll be talking about a few different scenarios, and how to tackle them, how to use your communication, and how to use your words to tackle those scenarios. For example, we have a patient who just keeps talking about the previous history and the previous episodes, and is just eating up your time, right? You know that the patient is wasting your time. For example, if the patient came in with headache and he had 10-15 episodes previously, and he's just talking about those episodes, that what happened, and then what happened, and then what happened, and then what happened, right? The patient is just wasting your time. So you're going to flip back the situation, and you're going to tell them that, John, I can see that this headache has been really bothering you, or it has been really distressing for you. So let's just talk about this particular episode so that it doesn't affect you like your previous episodes, right? So this is how you're going to flip back the situation, and make them talk about the latest episode, so that they do not waste a lot of your time. Okay, so how to acknowledge? Again and again, you have to acknowledge in almost all of the stations what the patient is trying to tell you, and then you're going to acknowledge that, I can see that's a big worry to have, or you can say, I can see that's been troubling you for a while, and I promise you that is the first thing we will come to very quickly, but let me just ask a few things, right? So if the patient, for example, the patient tells you that, I've been having this itch on my leg, and you tell them that, oh yeah, I can see that that's been bothering you for a while, and I'm sure, I promise you, that is the first thing I'll come towards, but let me just ask a few questions regarding this itch to make sure everything is okay, right? So another thing that you can say, that I can see that's really tough for you to talk about, and I'm really glad that you came in today to talk about it, right? That is another way to acknowledge the patient's symptoms. Another thing, a patient says a vague term. For example, the patient says that my child is acting snotty, or the patient says that I was feeling funny. And then you ask them immediately that what exactly do you mean by this, or what exactly do you mean by snotty, or you tell them that when people say these things, they can mean a lot of stuff. So can you explain a bit more about it as to what exactly do you mean by it, right? Similarly, always mention the child's name. For example, a mother came in with 30-year-old female. Emily came in to talk about her son Steve, right? So you are not just going to ask the mother that whether your child is up to date with his jabs, whether your child is up to date with his immunization schedule. No, you are not going to again and again mention your child, your kid, or your baby. You are not going to say these words. Rather, you are going to use the child's name. For example, Emily, I'll be asking a few questions regarding Steve's birth history. How was his birth? Is Steve up to date with his jabs? Are you satisfied with Steve's development so far, right? So use the child's name, okay? Another thing, never ever put blame on your staff or on your colleagues, right? If there was a medical error, do not put blame on your staff or your colleague. Like, I'm really very sorry that there was another doctor on the duty who missed this diagnosis, or who missed this finding on the X-ray, or who missed this finding on the ECG, right? Do not put a blame on your colleague. And similarly, um, do not, like, if the patient says something regarding your staff or your colleague, that your staff didn't behave well with me, or they misbehaved with me, or some particular person in the hospital, they misbehaved with me, you're not going to immediately apologize to them that I'm so sorry this happened, or I'm so sorry that. No, you are going to say that, okay, John, I can see that it was really upsetting for you, but I will inquire about this as to what exactly happened, and I will get back to you. Obviously, sometimes the patient, they give you a tough time and they say that, doctor, do you think I'm lying? Do you think I'm not telling the truth by saying that your colleagues, they misbehaved with me? So you're going to tell them that, John, I'm not saying that you're lying, but what I'm saying is that I was not present at that moment and I don't know what exactly happened. So I need to inquire about this further, to know more about it in detail. And if they misbehave with you, I'll make sure that they come here and apologize to you, right? So that is how you are going to tackle this situation. Again, how you're going to empathize with the patient, you're going to say, if this was me in your position, I'd feel just as embarrassed or as upset as you, right? Or you can say that this is really tough and I can see it's taking a lot of you. Or you can say that I can see this news has hit you really bad, or you've been having a lot on your plate, or you've been having a lot on your shoulder to carry on. How have you been coping up with it, right? These are some of the phrases which you can use to empathize with the patient. Again, there are a few things you have to avoid in your consultation. First thing, robotic introduction. As I mentioned before in my previous video, you have to avoid a robotic introduction. Don't do a robotic introduction. Be very natural, be very classy while introducing yourself, right? Again, do not ask this to each and every patient. How would you like me to address you? How would you like me to address you? No. If the patient comes in, their name is John Smith, the patient is in their 30s or 40s or 50s, you just call them John. If the patient is elderly, for example, in their 80s or 90s, then you are going to ask them, how do you want me to address you? Because elderly patients, if the patient's name is John Smith, they want you to address you by Mr. Smith. So only in those cases you are going to ask them that, how would you like me to address you? Then they're going to say that you can call me Mr. Smith. Otherwise, just call them by their first name, right? Again, while starting your conversation, don't just say these words. May I ask you a few questions? May I ask a few questions regarding your past medical history? May I ask a few questions regarding your social history? Don't say these things again and again. The patient is there to answer your questions, right? So just ask them questions, signpost them before asking those questions, but don't just keep on saying, may I ask a few questions, right? Again, another phrase very, very overly used in the PLAB2 exam. I'm so sorry to hear that. Okay, this is a good phrase. You can say that once or twice in your exam, but don't do it repeatedly. Don't keep on saying, I'm so sorry to hear this, I'm so sorry to hear that, right? I'll tell you guys a few alternatives of this phrase just in a minute as we move on, right? So, a patient who is just not opening up, how are you going to get the required information from them? You've tried each and everything. You've tried giving them confidentiality. You've offered them everything, but the patient is still not opening up. A very high yield sentence, which I'm going to teach you guys. Just tell the patient that I'm here for you, right? Or just say them, I'm worried about you. Focus on the you part. I'm worried about you. I'm here for you. I'm here to help you, right? Say these sentences in the same tone and focus on the you part to make the patient feel valued. And I assure you that as soon as you say this sentence, the patient would immediately open up and tell you everything, right? You uh, you take the information out of the patient by saying this sentence, I'm here for you, right? Okay, so let's move on. um, how When a patient tells you a few symptoms, you are not just going to manage their medical condition. You are going to ask them about their social status, about their finances, about eyes, about red flags. You are going to ask about each and everything, and then you are going to manage all of them. You are going to manage the whole situation rather than just their condition. That is what the PLAB2 exam is about, that whether you are managing the whole situation for the patient or not, right? For example, if the patient is depressed and the patient is struggling financially and the patient does not have any friends or anybody to talk to, you are not just going to manage their depression, but you are going to manage their finances as well, help them with their finances or guide them for their finances. And then you are going to guide them for their friendships as well by offering them befriending services in the UK, right? Similarly, if a patient with bullying, abuse, or violence comes in, you are going to empathize with them and you are going to tell them that bullying is not something you have to put up with. And I'm really very sorry that you are going through such a challenging situation, and we are here to help you, and we'll help you find a solution for this, right? So, if the patient tells you that somebody in their family passed away, their father passed away, or their mother passed away, don't just keep on saying, I'm so sorry to hear that, I'm so sorry to hear that, I'm sorry for this, I'm sorry for that. Some alternative sentences which you can use are, I'm so sorry, John, this has been really difficult for you. This must have been really difficult for you, right? Or you can say that I'm really sorry for your loss. Or you can say that such a huge loss must have caused immense pain to you, John. So these are some of the alternative sentences which you can use rather than saying I'm so sorry again and again, right? Another case in which a relative comes in to breach the confidentiality about their relative. For example, a mother comes in to talk about her daughter and wants you to tell them what did you prescribe to their daughter, or a son comes in to talk about his mother, or a father comes in, or a husband comes in to talk about his wife, right? So tell them that I cannot. Tell them that I can understand it's really, really frustrating for you, but I need to check if you have permission to discuss your relatives' medical records with you or not, right? You tell them this thing and then flip the situation back on them. You tell them that I can see, Mrs. XYZ, that you're really very concerned about your daughter and you're really worried about them. But what if your daughter came in and she wanted us to disclose your medical records? How would you feel about that? Right? You flip the situation back on them, and they would immediately like understand your situation. Similarly, if a person comes in, if a patient comes in, and they want you to disclose the information about somebody else, and then they start pointing towards you. For example, a mother comes in and she wants you to disclose information about her daughter or about her child. Then she says that, don't you have children? Aren't you worried about your children? So you can tell them that, Mrs. Suppose Emily, I can understand it is a really difficult situation for you, and raising children can be difficult sometimes, right? You are not going to get personal with the patient. I'll tell them, then don't bring my daughter in it, or don't do this, don't do that. Don't say such sentences, but say that I can understand raising kids can be difficult sometimes, or raising daughters can become, or raising daughters or sons can become difficult sometimes, right? Say such sentences. If the patient is getting personal with you, giving you personal remarks, don't take them to your heart, and don't bring those personal remarks into your consultation, right? Again, keep the patient involved at each and every step, during history taking, during your consultation, during your management, everything. Again and again, keep asking them, am I making sense to you? Let me know if I'm going too fast, right? Especially in the cases of in teaching scenarios, you are going to the examiners, they're not looking whether you know the stuff or not in teaching station. What they're looking for is whether you know how to teach the students or not. So you keep them engaged, you keep a hold on to their attention, and you keep asking them again and again, am I making sense to you? Does that make sense? Are you getting everything? Is that clear, right? These are some of the phrases which you are going to mention to them again and again, and you tell them that if you don't understand anything, you can stop me right there and then, and you can ask me any question that you want, right? Or you can tell them that, let me know if I'm going too fast, I'll slow down for you and I'll explain things to you in more detail, right? These are some of the phrases which you can say. And that is about it for today, guys. I hope this was a really very helpful session, and I would see you guys soon. Thank you so much.